2022, we tried to focus on a number of things that were health and safety oriented. And we have worked with Integral Care to try to start providing services in public schools, something that we have talked about before, but since we have seen kids away from school for 2 years, it becomes important to meet them at their point of need. When you look at the first 74 sites that were available to get a vaccine, 65 of them were west of 35. What we did through Constable Morales' office was to develop a completely new system of reaching out, which was decentralized. What we tried to do was work in churches with pastors and with the nursing staff, work in organizations that had professionals who were healthcare professionals, to work with what we call the Divine Nine, which is our fraternities and sororities, and many of them were designed to be service organizations. So we wanted to get the best minds in the community together to talk about how to build a system that was not run through traditional government processes and resources. So I think we were very successful in getting that done. Was it perfect? No, because we had to convince a lot of people who all their lives felt that they were not being well served. All of their lives felt that they were being talked down to. And we had to tell them that these are resources that we have put together. You are welcome to them. We want you to take advantage of them. And nobody's going to make you feel bad about it. And if they do, you tell us and we'll go fix that problem. As we ramp down vaccinations, you will see us ramp up other things like access to Wi-Fi, like after-school programs. And also I think we need access to job preparation programs and transportation programs. We had an excellent program that was run by Judge Bennett. And I think that they had really good resources for detox, they had really good resources for counseling, really good resources for 12 steps, but they didn't have money for job training and job placement. And oftentimes, particularly when you go through an addiction scenario, you've lost your job and you don't have a place to go. Well, if we don't address those basic addiction needs and then start thinking about housing and job needs as well, then we won't get a person to where they are sustainable in the community. So it's going to be important that we do the sustainability piece, and I think workforce is a key and access to housing is a key.